Hey guys, welcome to the channel. Today we're going to talk about some things that I do to alleviate my back pain. These will be more immediate things that I do when I have back pain now. This is going to be the first of a two-part series. In the second part of this series, I'll go over some things that I do to prevent back pain. But first, a disclaimer. The opinions or information in this video should not be taken as advice in any form, medical, financial, legal, or anything else. Please pause the video now to read the rest of the disclaimer or read it in the show notes. I came up with this list over 15 to 20 years through trial and error. We'll start with number 10 and count our way down to number 1. Number 10 is the Spineworks. This is an item that I got off Amazon.com, and I'll have a link to it in the show notes. But basically, it's kind of a rigid piece of plastic thing, and you lay on it, and it's supposed to align your spine. I did get some relief out of this thing. I have been told that I have reverse curvature of the spine, and to be quite honest, when I first lay on this thing, it's kind of painful and doesn't feel very good. But after I lay on it for a little while, that starts to feel better, and I think it does provide some help for me. Number 9 is an ice pack. Not too long though. I only use one for 10 to 15 minutes at a time, and if my skin starts to feel numb in that area, I'll remove it immediately. I was a little skeptical about this one, but it actually works better than I thought. It seems to have the effect of taking an ibuprofen or something, and it's a non-drug way to get some relief from inflammation. All ice packs aren't created equal though. This blue one that I'll have a link to in the show notes is a lot better than just putting it in a plastic bag or something. It seems to sweat a lot less and is a lot more comfortable. They're dirt cheap too. They are a pretty cheap and effective solution. Number 8, stretching, especially if my hamstrings are tight from working out too much, from running or biking. I've got 2 simple stretches that I'll do. The first one, I just sit on the floor and try to touch my toes, basically. A lot of times I'm so tight I can't even get close to touching my toes, and I'll just grab my leg or something and try to pull forward as much as I can. I'll hold these stretches for 20 seconds, maybe up to a minute, and over time I'll get a little bit more limber, even during that stretching session. The other stretch I do is the ballerina stretch, just where I hike my leg up on a bar, sometimes a windowsill, just something a little over hip height, and I'll lean forward. And when I do these stretches, it seems to loosen my back up. Number 7, a high-density foam roller. Similar to the one I've got pictured here on the slide. I got this at Amazon. I'll have a link to one in the show notes. I keep a smaller one of these at work too, which is very handy. I have an office that I can actually roll on it sometimes if I'm having some back pain at work. But at home, I've got the bigger version. It's about 1 yard wide. It's probably 6 to 8 inches in diameter, and it's pretty dense. And it actually kind of hurts a little bit when you're rolling on it, but there's various different ways you can roll on it. I mainly just roll on it lengthwise, sometimes all the way from my feet to my head sometimes, and it will loosen you up quite a bit. I was quite pleased with how well this works. This thing works super good, in my opinion. It's probably one of the most bang for the bucks things that I have in my arsenal to treat my back pain, and they're cheap. They're like 10 or 20 bucks. So I wish I'd found out about these years ago. Number 6, magnesium as a muscle relaxer and non-steroidal anti-inflammatory drugs, or NSAIDs. Those would be like ibuprofen, naproxen, those sort of things. Of course, before making any changes to any of your supplement or medications, please check with your doctor or pharmacist or healthcare provider. As far as the magnesium goes, I take 1 capsule nightly, sort of as a preventative measure, just to kind of keep my back loose at night, and that seems to work pretty well for me. When I wasn't taking one nightly, I would take one when I was having a back spasm, and that seemed to help. Other people I know use magnesium oil and will rub it in. They get some relief from that, they've told me. Other people will use Epsom salts in a bath and soak in it, and that seems to work well for them. As far as the NSAIDs go, my preferred NSAID is naproxen. I'll usually just take one, I think it's a 220 milligram tablet I'll take once or twice a day, 12 hours apart, and I'll just take that for as little time as I possibly can. Doing this seems to help get the inflammation down, which provides me with some immediate relief. Number 5, BioFreeze Spray. This was first recommended to me by my chiropractor. I bought it at his office, but I've since found it on Amazon and Walmart, and I'll have a link in the show notes. It has menthol in it, so there is a bit of a smell. However, I find that the spray evaporates pretty nicely and it doesn't get all over everything too bad. I will wear a t-shirt or something often to kind of shield that menthol from other things I don't want to contaminate. But this stuff's pretty awesome. Number 4, warm water. I start out my morning by taking a warm shower, and of course that just helps get me going. But I also use it if I have acute back pain. I'll jump in the shower or a tub or a hot tub and just soak for a bit. Obviously not too long. I use some precautions here, but the warm water I find just loosens me up quite a bit. Number 3, movement. Movement in general really helps out my back. Road biking really helped it out, just that movement from the pedaling. Walking about 400 meters, even when I really don't feel like it, which is basically every morning, really helps to loosen it up. Also, I'll do some exercises called cat and camel. I'll do about 10 of those quickly, just jump down on the floor and do those real quick. Google it and you'll find some really good examples on those. Number 2, a great chiropractor. They are not all equal, let me tell you. I have been to a few that have been awesome though, and have really been able to help me out, especially in the short term. They didn't fix it for the long term, but they definitely helped me over the short term. I like to steer clear of the ones that want to put you on some sort of a payment plan. I'll mention physical therapy here as well. I know that's a lot different than chiropractors, but I have seen a lot of people get good results from them, just not me personally because I haven't tried them. But they do seem to provide a lot of help to a lot of people from what I've seen and heard. And finally, number 1, Bowen Therapy, also known as the Bowen Technique. Bowen Therapy helped fix the reverse curvature of my spine that other therapies never did. You can Google that. I didn't get an official diagnosis, but I had several chiropractors tell me that I had it over the years. They could never fix it. Locally, it cost about $60 per session, and I saw massive results after just 3 sessions. Those 3 sessions made me feel so good that I went back and had several more just to see what else they could fix. It had long-lasting effects for months, maybe even years. I haven't been back probably in a year or 2, and I still feel better from it. It's just phenomenal. It's kind of a weird technique, so I'll tell you to go ahead and just Google it right now. It's bizarre, but it's the best thing I've ever found. Thank you so much for joining me today for the video. If you liked it, please hit the thumbs up button and subscribe. And also look for the link for the second part in the video where I will explain some things that I do to prevent back pain in the first place. Till next time, we'll see you.